Welcome back. Here with us on Urban Debate on Mirror Now. Over the past few weeks, we are seeing a steady rise in COVID cases across the country. In the last 7 days itself, COVID cases have gone up from 15,000 to 19,000 in India. The worst affected states that are contributing the most to this COVID tally are Delhi, Haryana, Kerala, Uttar Pradesh, as well as Maharashtra. Naturally, there are concerns of a fourth wave as well. And at this time, the Supreme Court has given a very significant order saying that nobody can be forced to get vaccinated. The top court has observed governments have not placed any data to prove that unvaccinated people spread virus more than vaccinated people. Until the cases are low, no restrictions shall be imposed on unvaccinated to access public places. And to help us understand the current COVID situation in the country, we are joined by Dr. Gagandeep Kang, India's top and most celebrated virologist, and she's joining us on the show tonight. Dr. Kang, thank you very much for joining us here on Urban Debate on Mirror Now this evening. What is your assessment of the current spike in COVID cases? Is this the beginning of the third wave, or are we already into the fourth wave?
I think, Heena, it's really important for us to distinguish what we call a wave in the future, because there is a difference between cases and actual disease that lands people in hospitals. What we will continue to see in the future is that if we keep testing a lot of people, we will have ups and downs in the numbers of cases. Right now, what we are calling a spike or calling increasing numbers of cases were very ordinary numbers for us in January. So I think it's relative to what we saw last week that there is a slight increase in the number of cases. And I don't think that we should be worrying about people who test positive anymore. What we should be thinking about is there a difference being made to hospitalizations with COVID-19 or for COVID-19? And at the moment, there does not seem to be an increase in hospitalizations across the country. So a few cases here and there in bigger cities, but not something that I would call a proper disease wave. I don't think that we are seeing that.
Dr. Kang, given the fact that hospitalization rate remains low, positivity rate has crossed 1% mark after a little over 2 months. It was 1.11% in February this year. However, if you look at Delhi, the positivity rate is around 5%. How concerned are you? Should we still be on this wait and watch mode?
No, I think it's very important to remember that we don't have identical testing strategies in different places anymore, right? Different people, different administrations have different triggers for testing. And if you have a greater number of tests being done, you will, as long as there is some virus circulating, detect a greater number of cases. Yes, test positivity is important, but test positivity is important only if the testing strategy is identical across the country, which we know it is not, right? So I would not worry too much about tests positive or test positivity rates at 5%, anything up to 10%, because the numbers that we need to track now are really hospitalizations and deaths. And so far from those, we really don't have a signal that there is a problem in this country.
And this is the sub-variant of Omicron only, nothing else, right, that we are seeing in India?
Well, until we sequence every last strain that is circulating in the country, we can't say the nothing else. But at least if we derive from what is available in India and what is available in the rest of the world, most of what is circulating today is variants of Omicron. And in India, we started with BA2, we have 4 and 5, we will have other variants as well. You remember the hangama about the XC variant a couple of weeks ago. The important thing to remember is that variants matter when they cause severe disease in people who have already been vaccinated or infected. So far, there is no signal that any of the variants of Omicron are doing that. So I think this is not something we should definitely continue to track it. Make sure we have sequence data. Very importantly, link that sequence data to clinical information so that we understand how much of a threat we are dealing with. All of the information that we have so far means that we need to continue to watch, but we don't need to worry.
Any specific reason why children are testing positive this time?
So this is exactly where I'll take you back to what I said earlier. What is the testing strategy? Are we testing adults and children at the same rates? Or are we preferentially testing more children? With schools opening up, we are seeing a lot more testing in children. So it's natural, of course, that children mixing with other children are going to test positive. The important thing, as I keep emphasizing, is are those children getting really sick? You know, if we look at viral infections, particularly respiratory viral infections, there's never been a virus that has been tested quite as often as this one. So if we were to take influenza and do exactly the same thing, take the seasonal coronaviruses and do exactly the same thing, I can tell you that we would see patterns in terms of people testing positive very similar to the patterns that we are seeing now. They may differ a little bit in time, they may differ a little bit in scale, but respiratory viruses follow these patterns of lows and highs. And respiratory viruses, the coronaviruses and the influenza viruses are RNA viruses that evolve. That's why the tracking is important, but that's also why we should not worry too much when we start to see variants that do not cause severe disease.
Interesting, and this allays a lot of concerns that parents have today as well. Now on vaccines, the Supreme Court today has said that no one can be forced to get vaccinated. Bodily integrity is protected under the law. Supreme Court upholds individuals' right against forcible vaccination. How will you like to respond?
I think the Supreme Court is absolutely right. I don't think we should force any medical intervention on a person who believes that they do not need it. However, there can be situations where your privileges might depend on the fact that you are not a danger to others. Now, the question is, are we talking about infection? Are we talking about disease? And which variants does this matter for? Until Omicron, it was very clear that vaccinated people actually had reduced ability to transmit and were protected themselves. With Omicron, we know that the reduction in the ability to transmit among vaccinated people is only fractionally less than what you see in unvaccinated individuals. It's there, but it's a lot less. So there comes the question, are we stopping transmission? Are we stopping people from being dangers to others by making sure that they are vaccinated? I think in some situations, it's really important to make sure that people are vaccinated. For example, if you are a healthcare worker And particularly if you look after people who are immunocompromised or the elderly, your occupational requirements should require you to be vaccinated. Just like we do with the hepatitis B vaccine, where we insist that all healthcare workers are vaccinated so that there is no transmission of disease to their patients, right? So I think in those situations, insisting on vaccination is absolutely the correct thing to do. In other situations, you may want to make certain other conditions that you place on people. For example, an unvaccinated person might be asked to wear a mask where others don't necessarily need to do that. You might want to put them in an occupation that is not person-facing. So those are things that employers can decide to implement, and I think they would be within their rights to do that.
Dr. Gagandeep Kang, the Supreme Court has also directed the central government to publish reports on the adverse effects of vaccination. Do you think this can help citizens take an informed decision?
We do know what is in the vaccines, we actually do know what is in the vaccines, and no vaccine would be licensed if the composition was not available to the drug regulator. But I think it's also important to emphasize that there is no drug, no vaccine, which is 100% safe. And because vaccines are given to healthy people, there is a remote chance that there will be a serious side effect. Fortunately for us, the SARS-CoV-2 vaccines are very, very safe vaccines. Mostly what you get is fever, local pain, redness, swelling. You're out of action for a day or two. Some people, of course, are lucky and get nothing. But there are rare side effects that are associated with the vaccines. The mRNA vaccines, there is a small association with viral myocarditis, particularly in young people. With every vaccine, there is a risk of anaphylaxis. With the viral vectored vaccine, there is a risk of thrombosis with thrombocytopenia syndrome. All of these are very, very rare events. And if they are recognized early and the right treatment is instituted, then the serious adverse events consequences can be mitigated for the most part. I'll give you the example of Australia. The case fatality rate of Australia, which has a really good monitoring system for safety, has a case fatality rate of thrombosis with thrombocytopenia syndrome of 3%. So you can imagine this is something that occurs in somewhere between 1 in 40,000 to 1 in 250,000 vaccinated individuals. When it happens, 32 out of 33 people survive if they receive the right treatment. That's why I think monitoring AEFIs, recognizing AEFIs is very important, because it allows people to assess risk. It allows people to recognize when they are having symptoms of serious adverse events. It allows doctors to treat them. And overall, this recognition that there are side effects, but that side effects can largely be handled, is very important for building trust in the healthcare system.
But Dr. Gagandeep Kang, the masks, vaccines, they've been our weapons to fight COVID pandemic. Can these be made optional? Or do you think we have entered endemicity already and hence these can be made optional now?
I think we were endemic a while ago. So the question is, how do different people seem to define endemicity in different ways? To me, endemicity is something where you know that you've got an infectious disease that is in your population. It will have ups and downs. But for the foreseeable future, you're going to need to live with this infectious agent. And that point of endemicity we reached a while ago. Now, that doesn't mean that we will not have increases in cases, that we will not have new variants. Absolutely, that will continue to happen. But where vaccines and masks are concerned, I think we've done the important job of giving the bulk of the country vaccines. And the government did an amazing job of getting those vaccines out and giving them to people. Now come the more complicated questions. You know, the rest of the world is giving boosters. We now have permission to get boosters. Should we be boosting? Which vaccine should we be boosting with? Are the vaccines we have today good enough for the variants that we might see 5 years down the line? When do we start to work on new variants? What combinations should we use? These are questions that we need for scientists to begin to address them through clinical research. This can be done, this must be done. The rest of the world has already started doing it. We need to start doing the science that will inform tomorrow's policy. Where masks are concerned, masks, unlike vaccines, are a catch-all protective mechanism. Vaccines protect against the disease that they are designed to protect for. Masks protect against all respiratory infections and pollution. So masks, I think, are a bit like raincoats or umbrellas. If you think it's going to be really hot, really rainy, use an umbrella, right? If there is very little disease out there, then masks can be made optional. As soon as there is a lot more cases being reported, then the masks should come back on. And there also, you might want to have a grading about who wants to wear masks or who should be wearing masks and at what times. Outdoors, masks make very little sense. Indoors, and particularly in unfamiliar company, and if you are at risk, masks make a lot of sense.
And one last question before we let you go, since you mentioned booster shots, what's your view on the gap between the second shot and the booster shot? Do you think we need to reduce it?
So I think it depends on what you want your booster to do and the situation in your country with rising cases. Now, we've seen from the West that you may want to boost as early as 3 months or 5 months, because by about 20 weeks, protection against Omicron, but not against Delta, had dropped to practically zero if you were looking at infection. Now, can we afford to vaccinate every 5 months? We can't. If we don't have an Omicron wave going on, does making everyone take a booster now have value, given that 5 months down the line, this booster is predicted not to work? So I don't think I would respond to decision-making around boosters by tracking clinical data from other parts of the world about vaccine failures and looking for vaccine failures in our own country with the vaccines that we have used, particularly in high-risk groups. And as soon as you see a signal of vaccines failing, that's when you should decide to boost. We also have to remember that this is a virus we're going to be living with forever. Do we really want to be taking boosters every 3 months or 6 months or 9 months? Immunologically, the longer the gap, the better the protection you will have.
The longer the gap between the second dose and the booster shot, shot, the better the protection. So that's your view. Dr. Gagandeep Kang, thank you very much for speaking with us here on Urban Debate on Mirror Now. So that was India's top virologist and professor at Christian Medical College, Vellore, speaking exclusively to Mirror Now on the prevailing COVID situation and what next should India be looking forward to. With this, it's a wrap. Thank you very much for staying with us here on Urban Debate on Mirror Now. Heading into another short break. Griha joins you next. Stay with us.